environment. She's very cold, indicative of loss of blood supply. Now, if we also take a picture of that foot, yes?
Yeah, just about this bandaging. I read some research about that bandaging can harm a horse more than it can do good, because you're taking away the natural way of the
movement
mechanism.
Right.
Have you seen anything like this? Because it's a really common sold product, but...
Yes, I do see that. I see a lot of times bandages, people are putting bandages on them and not allowing the movement of the legs because they feel keeping that injury confined will help it to heal better. In some situations that helps, but not in all situations. But we've gotten so used to putting a bandage on to cover it up, and then we've protected that leg. Well, we're not protecting that leg at all times. So it's a very good question, yes. I think...
Yeah, as well.
I think exercise bandages can do the same thing. I think sometimes we're overdoing it with those. I think if we just allow a little more movement on these legs, I think you'll have a lot less injuries to them because you allow more free movement. Is that what you're asking? Well, some tend to have stocking bandages and stuff that go up the legs and stuff that tend to be a little more restrictive. And I think is that what you're talking about, more along that line?
In the research, they tested the temperature inside underneath the skin and on top of the skin, and they saw a big difference between horses that were between when the horse was wearing the bandages and without, when they were working. And they saw the temperature was rising to critical levels, especially when they worked hard.
Right.
And because they didn't have the cooling mechanism they have without the bandaging, they were saying that it could really cause
too much heat and too much heat there.
real damage in the tendons.
Absolutely. Yeah, you can do a lot of damage with bandages, and I think you're absolutely right. I think what happens is we tend to use bandages too much to kind of protect the legs, and we're actually can be doing more harm than actually good. So yeah, I agree with you.
I maintain the same theory with shipping, and it's not so bad on terrestrial shipping in a truck or a trailer, but air shipping, these bandages are just killers. You need to stay off them. Yeah, but my horse is going to injure his leg with the other foot, you know. Yeah, maybe.
Well, especially
but
when
I'll
you're going...
promise you he's going to injure his leg with the bandages on.
Yeah.
I think especially with high altitudes and stuff, when they're flying and things like that,
You can talk to the pilot and you can tell him, please keep us no higher than 6,000 feet. That's what I try to do when I'm shipping, but they don't, they don't do it. And I know that when I fly, my boots get too tight.
Yeah.
Quite a bit too tight.
Yeah.
And horses are far more sensitive to that sort of thing than we are. And I've seen 6 and 8 horses get off of a charter flight with big tendons.
Yes.
And you know very well it's from the bandages. Yeah. I'm dead set against shipping bandages, even in trucks and trailers. They put these big old boots on them behind, clear up over the hocks.
Yes.
And then the horse gets in there and they get spooky of that and get them down and twisted, and then they'll kick the back end of the trailer out and tear their legs up. And if you just left them bare, they'd probably get out of there all right. Anyway, I won't.
No. What's that? Teach him to be calm, he says.
Yeah.
Right.
Stay with nature.
But this foot right here, if you look at, we've done vascular testing and stuff on this. You see from the fetlock on down, this foot has no blood supply to it whatsoever.
And this is the bandaging stuff?
Now, this was a horse that had frostbite on his foot. Yeah.
Is that pretty common up there in the cold area?
Yes. Not in California, but it is in Ohio, yes. Yeah. Especially the kind of winter that we've had this year. We've had sub-zero weather quite a bit and a lot of snow and a lot of rain and stuff. So it's been pretty bad out west, back east in the Midwest. So you want to look at the quality of the vasculature of the blood flow to tissues, because some pre and post exercise sometimes can make a difference. Can tell you whether you've got good blood flow or not. Thermography of the hoof. For a lame horse, this kind of goes into a chart. If you're looking at the normal foot, this is basically what a normal foot will look like. Side views. This is the back of the front legs from looking at the horse from behind. This is the back legs. And so you can look at laminitis especially. When these horses with laminitis come in, you can tell whether they'll say, well, the horse just got this. Well, you know, I can tell them whether they're telling me the truth or not just by doing a thermographic image. This horse didn't just get this. This horse has had it for a while, and he's just been totally misdiagnosed or mistreated because of it. So when you get an acute laminitis, you'll get look at several areas between the hooves, between all the hooves, and also the heels, the bulbs of the heels. And you'll see there's a lot of white and inflammation towards the heels because the blood supply is being restricted a little bit because of what's going on. Acute laminitis. Generally, the coronary band is 1 to 2 degrees warmer than the remaining hoof, but the hoof becomes as hot as the coronary band. And you can see how hot this hoof is. It's extremely hot. Huh? No. We can go into saddle fit another time. Anybody know what x-ray this is, what racehorse this is? Barbaro, yes, absolutely. This is an x-ray of Barbaro's leg before and after they had done the pinning and stuff on it. And this horse Barbaro was not put down from this leg. He was put down. This is that leg from the pins. This is the opposite front leg. Because of what he had to do, he had to compensate. So he was put down because of laminitis. He was not put down because of the surgery. So it just shows you how serious this horse had a problem and stuff going on, because they take all that weight off of that leg trying to compensate. So now you want to differentiate laminitis just from sore feet. This is 7-year-old developmental walking on eggs gait. So they just look like they're trying to walk on eggs all the time. This is more of a chronic laminitis. See how this is rotated, but you can see how the blood supply has changed in his foot. Begins with P3 displacement, usually noted decrease in temperature at the coronary band. So see, there's not much color around that coronary band at all. Post-chronic laminitis signifies the stabilization of the lamina. Pain is due to inflammation associated with malposition of P3 within the hoof capsule. And this kind of gives you a venogram to show you what the venous blood supply is of that foot, and then on the right shows the thermography of that same foot. On the left is the foot. What they had done is they had actually paired this foot out. After they paired this foot out, then we did thermography on this hoof afterwards, and you can see there's already increased and improved circulation in that foot, that same foot, after we paired that out. This was probably within 10 days or so afterwards. Thermography allows a qualitative analysis of inflammation due to the acute phase. This may have therapeutic implications for treating it. Conclusion, thermography documents the circulatory changes noted during the chronic phase. It can document the effect of therapy on the circulation of the hoof. You can also look for foot pain, assessment of blood flow, pre and post exercise tests. Differentiate hoof wall inflammation from deeper problems, palmar foot pain. Inflammation of the hoof wall in the heels and the quarters. Palmar foot pain. Collateral cartilage inflammation. Inflammation of the sole. Alterations in hoof weight bearing. These are 2 front feet on the same horse. And you can see the right one has got a lot more inflammation going on than the left one, because this horse is compensating for pain that he's got going on. The carpals and tarsals, thermal pattern in the dorsal palmar, it showed you a little bit of this, are relatively cool on the front, cool on the tendons, and there's change in blood supply here. And we're also looking for heat and cold areas in those tendons. Hot spot, associated with local inflammation directly over the injuries where you're going to see this. Ultrasound exam, cold spot, same type of thing. You see swelling, thrombosis, infarction, scar tissue, changes in sympathetic tone, and so you're looking for that cold spot. And then also you've got hot spots associated with it, because your body is trying to compensate for this lack of blood supply there. It's trying to get it there as much as possible. Got normal tendons, bilaterally symmetrical,